Hello and welcome to an awesome virtual session for 97.3 WMEE's Baby Fair and Family Expo presented by Lutheran Health Network. We have a ton of information to go through today, and joining us, and thank you so much for being here, we have Dr. Tamika Rosema, who is a pediatric cardiologist who examines, treats children through infancy, from infancy through adolescence with congenital heart disorders and that acquired heart disease. She has presented on a ton of pediatric topics in several cities across the country. Her articles published in numerous scientific journals, including topics like neonatal cardiomyopathy, palpitations in the pediatric cardiology outpatient office, and cardiac complications of infants of diabetic mothers. So, Doctor, first of all, thank you so much for being able to join us today.
Thank you for having me.
And you are going to be speaking about some of the top cardiology issues that you hear most often from parents. And This is going to be a really great informational session. Are heart questions common with children and parents?
Yes, very, very common. Some of the questions and things that we'll go over are, second and third reasons why people are seen by their primary care providers. So very common.
So with that, we have a really awesome presentation that we do want to get into. And throughout this presentation, there's information in there, helpful information for moms, for dads, extended family, where you can really know about some of the top questions that you're going to receive from parents, the top questions you would get from parents about their baby's heart. So I think we should just dive right into it.
Sounds great. Thank you, Boomer. So the topics that we're going to cover today are: what are murmurs? What are common color changes in infants? What is the normal heart rate range? Talking about the importance of dental hygiene and what we call red flags or some warning signs to watch for that would lead you to seek care from either your primary care provider or the emergency room. So the first question that we frequently get is, what is a murmur? Murmur just means sound. Most people think that murmur refers to that there's an actual problem with the heart, but it does not. So murmurs do not equal heart conditions. And what we talk about is, or the example that I like to give is a hose. And that's why there's two pictures of the hose. So on the left-hand side, you see the water coming out of the hose, nice and smooth. If you were to listen to that hose, you wouldn't necessarily hear any sound out of the hose. But the moment you put your thumb over the hose, and then if you were to re-listen to it, you would hear a sound inside that hose that would be classified as the murmur of a hose. So murmur just means sound. So murmurs are very common in the pediatric patients. Some reports say that greater than 50% of pediatric patients will have a murmur at some point in their life. And that's just because their hearts are so close to their chest wall, they don't get all of that extra tissue that we as adults do, that it's pretty easy for us to hear normal blood flow when the patient's really quiet and the room's really quiet. And so this is a picture of what a heart actually looks like. There are 4 chambers in the heart, 2 top chambers that we call atrium, 2 bottom chambers that we call ventricles. And then there's 4 valves, or kind of like the doors of the heart. And the best way to think of a valve is that when the valve is open, it's supposed to let the blood through unobstructed. And when the valve is closed, it's supposed to prevent the blood from coming back. So the blood travels through the veins, which are in the blue, goes through one valve, goes to the bottom pumping chamber, goes through another valve to the lungs, where we take a big deep breath in, our blood picks up oxygen. Now it comes back to the left side, and that's why it's red. And it goes to the top chamber, goes through another valve, the bottom pumping chamber, and then out to the main artery of the body called the aorta. Now, there are several different types of innocent sounding murmurs, and that's what we call when it's not related to some form of congenital heart disease. And the only way for us to know how a murmur sound, like which way a murmur is going to be, is it related to normal hearts or is it an abnormal heart, is to listen to it. And so if your primary care provider hears a murmur, again, it does not mean that there's true abnormalities with how the heart is formed or how it's functioning. It was just important for us to listen to determine which category are we dealing with. Congenital heart disease occurs in about 1% of all live births, which makes it the most common birth defect. Most people don't realize how common it actually is. Some of the most common types of defects are ones that don't cause any issues, but are still followed by us pediatric cardiologists and can cause murmurs. And not all heart defects actually have a murmur. And so we rely on other findings if that's the case as well. So below are 3 examples of some of the more common birth defects that we see. On the left-hand side, if you look, there's an arrow between the two top chambers, and it's showing that blood is going from the left side to the right side. That is called an atrial septal defect, where there's a hole in the wall that separates those two top chambers. ASDs are pretty common. Every baby is born with a small flap inside of their heart, and so sometimes they just have that flap, and sometimes they actually have a true hole. We tend to follow those initially in the beginning. Sometimes they do require closure, but not always. The middle picture is a picture of different types of what we call ventricular septal defects. And those are holes in the wall that separates those two bottom pumping chambers. As you can see, there are multiple different arrows showing that there are 4 main types of ventricular septal defects. VSDs is what because we're lazy, we like to, simple how we talk. VSDs are some of the most common birth defects, and the most common types of VSDs are ones that never require surgery or some sort of intervention, but they definitely can cause a murmur. That would not necessarily be an innocent murmur, but again, how it sounds really lets us pediatric cardiologists know how worried we need to be about it. We do tend to follow those until either they close, either naturally as the infant grows, or because they require surgery. And then the last picture is actually one of becoming, and we're recognizing it more, as probably the most common birth defect. And you can see that that valve, which is a picture of a valve, on the left-hand side, that there's 3 different what we call leaflets, or true, that it's a normal valve. And on the next picture, that there's only 2 leaflets. And so that's called a bicuspid aortic valve. That valve over time just starts to have normal wear and tear. And sometimes we can hear abnormal sounds connected to that as well. And again, these are 3 conditions that can cause murmurs that don't necessarily need to have surgery or an intervention, but do require follow-up with a pediatric cardiologist. The next topic that we'll talk about is color changes. I know this is really scary and super common. So what we frequently see in infants, and I had an attending who always joked that you never watch an infant sleep because you're going to see a lot of crazy things and it's going to be very scary. Color changes are when things just look different in an infant, and not all of them are worrisome. This picture is showing what we call acrocyanosis, which means blueness of the hands and the feet. It's very common in neonates, meaning those in the newborn nursery in the first few months of life, and it is not related to a heart condition. The theory is that the nerves are immature in an infant, and so they are super reactive and they actually constrict really tight. And so that just causes the blood vessels, which look blue, to become more blue. So acrocyanosis, so blue hands and blue feet, as long as the infant is otherwise fine, meaning they're growing well, they're otherwise acting like their normal behavior, is common and does not mean that there's a heart condition. And we see that uncommonly and hopefully don't necessarily need to be referred to a pediatric cardiologist. Other common changes are when the baby is crying for their face to turn red. Sometimes if they're crying really hard, then they can become a little pale. That's not uncommon as well, and that's just more related to changes in their vasculature, just with how hard that they're crying. And their skin tends to be pretty pale, so it's easier to notice those changes than, say, somebody with a darker complexion. So what are some worrisome color changes? As you can see here on this picture, that child is older. So we're not talking about, somebody in the newborn nursery or within the first couple of months of life, but not only are the hands and the feet blue, but around the mouth and inside the mouth is blue, and the chest itself is also blue. So that's when we get more concerned about a true heart problem causing those blue color changes. So we say that when inside the mouth is blue, or on the chest, or what we call the trunk, is concerning, or when that blue color changes occur with feeding. We also get concerned about with the feeding, if that's changing how the blood is flowing and then leading to more some of those color changes. So if the blue color change is due to a true heart condition, when you are seen by your primary care provider or you come see us in clinic, we will put a pulse ox on your right hand. If the blue color change is related to a heart condition, this will always be abnormal, meaning that with acrocyanosis, when the hands and blue feet turn blue, they put a pulse ox on the hand and it's 96, 97%, then that's not a heart condition that's coming and going. If somebody is blue because of a heart, they're always blue because of their heart. Next, or the third topic that we get commonly is heart rate. So normal heart rates in infants and children are much, much higher than what they are in us adults. For a newborn, which we classify as 0 to 1 month old, the normal heart rate range can be 100 when they're sleeping up to 180 beats per minute, which is considerably faster than ours. And if a child is screaming or crying really hard or is sick and therefore they have a fever, their heart rate could be up to 220 beats per minute, and it still be the natural conducting system of the heart that's causing that. The concern that we have is if the heart rate is too high, is it something else that's causing that heart rate to be faster? In infants, so 1 month to 11 months old, the heart rate range can be from 90, again, up to 180. But just like those infants, if they're febrile or they're in pain, their heart rate can also go up to 200 as well. As the child gets older, we expect the heart rate to slowly decrease over time. When the child is sleeping, we also expect the heart rate to go lower. So if the heart rate is being monitored with, many of the commercially available devices, that is not concerning. When we're sleeping, we're not active, our bodies aren't requiring our heart to do a lot of work, so the heart can take a little bit of a rest, and we see that by having a lower heart rate. So why do we as pediatricians get concerned about too fast of a heart rate? Again, too fast depends on what the age. Too fast for an infant can be, in the mid 200s versus me or you. If our heart rate is 180, that could be too fast for us. There are rare cases of an abnormal heart rhythm, meaning an extra pathway inside the heart that is firing where that is an actual abnormal pathway, and that's what's causing the heart rate to be too fast. Those heart rate ranges that we get a little bit more concerned about are usually in the 210 to 250 beats per minute, so considerably higher than the natural rate that we talked about of up to like 180. How can you tell if that's what's going on, if your baby's heart rate is too fast? When you hold your baby and you feel their heart beating, if it feels like it is too fast to count, up to 180 to 200, it's going to be faster, but most people can still have a relative idea of counting it. But once you start having a heart rate of 240, 250, that's too fast to count. So that's one of those red flags that we'll talk about briefly in just a moment. Dental hygiene, I know it's not a topic for a pediatric cardiologist to be talking about teeth, but it's so important to have good dental hygiene, and it's never too early to start talking about dental hygiene. Having good dental hygiene is one of the most common and most profound ways that we can keep our hearts healthy. The American Academy of Pediatrics and Bright Futures, which is the American Academy of Pediatrics Prevention and Health Promotion organization, recommends that starting at 6 to 11 months, the parents start brushing their teeth with child toothpaste. And please note that child toothpaste is very different than adult toothpaste. And then at 1 year of age, children need to start having their first dental visit. And it's not at that dental visit that they're going to have a lot of, they're not going to get their teeth cleaned, and it's not going to be an intense visit like it is for us adults. But it's getting the child used to the space, it's getting them used to the smells and to the sounds. So over time, they won't be scared of the dentist and can be much more comfortable going to the dentist. So why does a pediatric cardiologist care about the teeth? If you want to go to the next slide. Because of germs. Those germs live in our mouth. And so every time we brush our teeth, and more importantly, when we go to the dentist and we get our teeth cleaned or we get cavities filled, those germs can get into our bloodstream, and all of the blood has to pass through our heart. And those bacteria sometimes like to attach themselves into our heart, and therefore can cause an infection inside the heart. So because of that, we always encourage our children to have the best dental habits, which would include brushing your teeth twice a day and going to the dentist twice a year. And if the dentist recommends getting cavities filled or root canals or anything that they recommend, we are for it. As long as anything that we can do to help foster having a good clean mouth is what we say. And there are some children that do require antibiotics before they go to the dentist because of their heart condition. And that's a conversation that you as a parent can have with your pediatric cardiologist if your child needs that. So lastly, what are red flags? And that is a common term that you're going to hear in the medical community. And really that just means warning signs. So just like what we've talked about for other aspects, what red flags are depends on the age of the child. What is concerning for an infant is not going to be as concerning for an adolescent child, let's say. So if some of these red flags are noted, please discuss them with your pediatrician first, unless you're able to get a hold of them, or if it's after hours and you can't get a hold of anybody and you have concerns, there is always the emergency room available here in Fort Wayne. Either, there's several different Lutheran locations, and we as pediatric cardiologists do have, we get consults from local emergency rooms all the time, so we are still available as well. So more specifically, some of those red flags are, next slide. So for newborns, if a newborn misses 2 feeds in a row, or, they used to take 5-10 minutes to complete a bottle, and now they're taking 30-45 minutes to complete a bottle, that's concerning. For infants, feeding is like running a marathon. So if they're not wanting to do what they usually do and think about how many newborns are missing feeds, that's what all they do, right? They sleep, they feed, and they poop, and then they cry. So if they're missing one of those things, then that's a red flag that there might be something going on. If they start not having the same number of wet diapers every day, so a normal newborn will have about 8 to 10 wet diapers a day. Today they had 6, tomorrow they have 4. That's concerning, that there's something going on, potentially with the heart or some other sign of infection. If they start throwing up, and I'm not talking spit up, but truly throwing up, that's also concerning. If there are changes in their breathing, in that they're breathing fast all the time, or they're breathing fast during a feed, like we just talked about. For infants, feeding is like running a marathon. So if I were to run a marathon today, I'd have to stop frequently to catch my breath. My heart rate would be high. I'd be breathing really fast. I'd be red in the face and sweating. So if babies start having those changes, then we get a little bit concerned that they could have some sort of heart condition. And the thing that is always hard to tell, and it is always a juggle and a balance, is even babies with true underlying heart conditions will still do typical baby things. So it's always a discussion between you and your pediatric cardiologist and your pediatrician. What we're seeing a concerning symptom, or is this just a normal baby thing? For infants, it's similar to newborns, but there are some other differences. So infants tend to have changes in feeding just in general. They're not feeding as often. So for infants, and this is, starting about 1 to 2 months up to 11 months old, if you see changes in feeding and that they're not feeding as well, or they're taking even longer to feed, again, just like newborns, that's concerning. If there's changes in their behavior, if they're sleeping more than they used to, then that's a concern. Or if they're sleeping less, and it's not like, oh, I'm awake and I'm interactive with you, but I'm not sleeping and I'm crying all the time and you can't console me and I've been crying for 45 minutes, an hour, that could be a sign that there's something going on, and that would be a time to consider reaching out to your primary care provider. So in summary, murmurs do not mean that your child has a heart condition. How the murmur sounds lets us know what type of murmur and what we're dealing with. So it's important for us to listen to the murmur. Color changes are very common. Like we talked about, blue hands and blue feet is super common. And it's not always due to a true heart condition. Babies' heart rates are much faster than ours, and it is normal to have a faster heart rate than, if you compared it to yourself. And if it is too fast to account, and there's concern that your baby's heart rate is too fast, there is time to address that. I don't want people to think that if the heart rate's beating too fast, that something imminently is going to happen. You have time, meaning take 5 minutes, you call people. You don't have to be super panicked. We still want you to be safe and address that appropriately. And remember, if you feel their heart rate and it's too fast to count, that's what we're considering and concerned for, and that's what to monitor for. It's never too early to start caring for your children's teeth and teaching them good dental hygiene. So brushing your teeth twice a day and going to the dentist twice a year. And red flags would be changes in feeding and either missing feeds or taking too long to complete a feed. Changes in peeing or voiding is what we say, not having the same number of wet diapers, changes in breathing, in that they're breathing faster and it's continuous or persistent, or changes in behavior, sleeping too much, not sleeping enough, not sleeping, profoundly irritable, meaning they're crying, nothing is consoling them, and you're going on 45 minutes, an hour, 2 hours, 3 hours. Persistent changes are some of the last red flags that we care about. So thank you for listening. I hope I provided some great information and reassured you in some ways. And if there are any questions, please consider reaching out to our office or your local primary care provider with those questions, and then they can help direct you from there.
I really think having that right at the end of like the common red flags is going to break things down very nicely for parents, because as you said, parents are going to be very in tune with any type of just very small, minute change in their infant. And then knowing some of the major red flags is really going to kind of help them and guide them in what direction they need to go if they actually need to seek help. Yeah,
I agree.
And again, if people were to reach out to you, if they have questions, if they are concerned, if that red flag is getting waived, how should they contact you?
So we would recommend you contact your pediatrician or your primary care provider first, and listen to what they have to say. If they have the ability to bring you into office and take a look there, then that is safe. And if they have concerns, then they can reach out to the emergency room. To come see us in clinic, we do need a referral from your primary care provider. You can't just call up to our clinic and say, hey, I need to be seen for this. And if there's some of those red flags, like their heart's beating too fast, or they're not peeing as well, or they're sleeping through feeds, then those are the signs that the primary care provider is probably going to say, I want you to get to your local emergency room. And all of the emergency rooms in town now know how to get a hold of us. So we would be getting held in that way. So first and foremost, always consider contacting your primary care provider first and seeing what they recommend, and going then, depending on what they say, either going to the emergency room or consider referral for murmurs. For those color changes, we can see that in the clinic pretty easily, but we do need a referral from a primary care provider to do that.
Well, thank you very much, Doctor. There is so much great information here, and I can see parents going back and going through this presentation again and again, just because of the information that is presented there. And thank you for taking the time for putting this together for us, and thank you for joining us for our virtual Baby Fair and Family Expo session. Dr. Rosema, we appreciate the time, and I know you've really helped out a lot of parents today with all of this info.
Thank you. It was my absolute pleasure.